So welcome everyone. Thanks for being here this evening or whenever you're watching this, if you are watching a recording. Let's just take a few breaths together and just land in the space so we can bring ourselves into the present moment and just be fully here for this next little while. So just find your feet on the ground, or if you're sitting on the floor, go ahead and just feel your body rooted into the floor or whatever it is that you're sitting on, and just take a couple deep breaths. And you can look at the screen or you can look in the space, at the space that you're in, and just sort of arrive a little bit more fully through the breath. Good. And as we land here with our breath, I just want to start this info session with a treaty acknowledgement. So I want to begin by respectfully acknowledging that I'm coming to you today from Treaty 6 territory. This is the traditional lands of First Nations and Métis people, known by its colonial name of Edmonton, Alberta. So I'm a descendant of colonial settlers on this land, and I also have a deep love and connection to Indigenous people. It's important for me to share both my physical and social location with you in efforts to re-visibilize Indigenous people and contribute to decolonization and the 94 calls to action from the Truth and Reconciliation Commission report of 2007. And my name is Rebecca. My pronouns are she and her. And you're here for a mental health first aid info session. So I don't expect this session to last longer than maybe half hour. If you need to leave sooner, go ahead. This will be recorded and sent out to everyone, as I mentioned. So thank you for taking the time to learn about mental health first aid and sort of the work I do as well. So I run a wellness practice called Raw Holistic Health and Wellness Services, which I established in 2008 after taking a diploma program from MacEwan University in holistic health. So I have lived experience moving through loss, mental health challenges, physical illness, addiction, and just really questioning what health, healing, and wellness really mean. I've led groups of high-risk youth, recovering adults, LGBTQ plus communities, school groups, holistic practitioners, business professionals, medical professionals, all in creative wellness classes and workshops, yoga, meditation, mindfulness classes, and workplace wellness as well. I am certified to teach and love leading yoga, meditation movement, as I mentioned, creative healing arts, relaxation and stress management practices with all kinds of groups. I also see folks one-on-one for self-care and stress management using reflexology, Reiki, and somatic stress release, and all of the above mentioned modalities. I also have an undergraduate degree in Applied Human Service Administration, also from MacEwan University. And I'm certified as a Canadian Mental Health Association certified psychological health and safety advisor. And so that is specifically working with workplace wellness and groups to create cultures of wellness that are sustainable. And I'm also a mental health first aid facilitator, which is why you're here. I've studied and continue to explore what it means to share my work in a trauma-informed way, and I've designed my services one-on-one to be accessible through a sliding scale. And if you see me one-on-one, you choose what you pay, basically. So alongside my facilitation work and working one-on-one with folks, as I mentioned, I help organizations to implement wellness initiatives, design wellness program plans that are all unique to whatever organization I am working with. And I love helping create wellness plans and programs that are really going to serve the needs of the people that are working there. I often work with other practitioners in collaboration and community to facilitate classes, workshops, and offerings. So if you are someone who is interested in everything I've just shared, and you maybe have a similar background or complementary background, connect with me. I love to do collaborations. I've been given the honor of facilitating mental health first aid as a result of my training with the Mental Health Commission of Canada and my experience as a holistic health practitioner working with clients who have experienced mental health problems and substance use problems, as well as my own lived experience. So in order to teach mental health first aid, you do need to have some of that frontline mental health experience as well. So I'm grateful, really grateful to the Mental Health Commission of Canada for allowing me to become a facilitator for them. I've benefited greatly from taking this training in my own personal and professional life. I've not only become better able to be resourced and have conversations about mental health with others, but I also have been able to apply the learning to my own mental well-being, and that's been really big. So in mental health first aid, I did use the term mental well-being. We try to use the term mental well-being as we can have a mental health or substance use problem, but we can manage them in ways that allow us to have good mental well-being. But in the training, you may all often hear the terms mental well-being and mental health used interchangeably. But we talk more about that in the training. So what is mental health first aid? Mental health first aid is the help provided to a person developing a mental health problem, experiencing the worsening of an existing mental health problem, or in mental health crisis. So just like physical first aid, which many of us, especially if we do work one-on-one with folks, have taken and need to take every couple years to be certified in whatever it is that we're offering. Or if you're just somebody that's interested in being able to save family members' lives, if there's a physical problem or an accident, first aid, physical first aid is wonderful to have. So just like that, mental health first aid is provided until appropriate support is found, or the crisis in the moment is sort of resolved, or until medical treatment can be obtained. Now that's sort of like the bigger picture, more serious mental health problems. But what I have really experienced from taking mental health first aid, and many others can relate to this who have also taken the training, is that mental health first aid really helps us navigate the more subtle waves of life that can feel really tricky as well. And so within mental health first aid, there is a framework that we learn that we can apply to ourselves and others, even if we're just maybe having a bad day, we're experiencing grief, we are navigating loss, we maybe don't feel resourced to handle the challenges that we're going through. These are all places where mental health first aid can support us. So a lot of people think, again, like I said in the beginning, that it's just for maybe frontline workers or people that are involved working with people with mental illness. But the truth is, I honestly feel in my heart of hearts that every single person can benefit from mental health first aid. And even if the training isn't with me, because there are facilitators all across Canada, I really encourage people to consider taking this training. And just like physical first aid, it is a training that they do recommend updating every few years just to stay fresh and sort of in the know. So that's sort of the background information. Mental health first aid is designed to help also reduce stigma of mental illness. So there is obviously a stigma associated with mental health problems, and evidence shows that taking a mental health first aid courses reduce social distance between people that are experiencing mental health challenges and people that may be observing people having mental health problems. Oftentimes, we maybe walk away from people who we see having a difficult time, either because we're scared, we don't have the tools, we don't think it's our job. And in many cases, we do need to take care of ourselves. That's an absolute priority. But taking a mental health first aid course can help us feel less scared of maybe approaching somebody that looks like they might be having trouble. So just like physical first aid, again, if needed, it's provided until medical support can be obtained or until things sort of get better. It also helps to raise awareness of mental health issues. So 1 in 5 people will experience a mental health problem this year. Like that's a big, big part of our population. And chances are that either you or somebody that you know have experienced a mental health problem or a substance use problem at some point in your life. So that's just, a fact. And we know that it exists. And especially post-COVID, we're disconnected. The world is a little bit wild, and it can be a difficult time to be in right now. And so I think that mental health first aid is even more necessary now. So evidence shows again that mental health first aid participants increase their awareness of the signs and symptoms of the most common mental health problems. And then again, it improves confidence taking this training. So the most difficult part of intervening is knowing what to say, right? So evidence shows that taking a mental health first aid course increases confidence of the participants in having engaging conversations with somebody who may be experiencing a mental health problem or crisis. So lots and lots of reasons to consider taking mental health first aid. That's sort of the background of it. Where did it come from? Well, Mental Health First Aid is run by Mental Health First Aid International, actually out of Australia, but it is taught in over 20 countries in the world. It's an internationally renowned program. And in Canada, it has been stewarded. So in each country, there is an organization that takes on the mental health first aid sort of license and trains people in the country. And so in Canada, it's the Mental Health Commission of Canada, which is funded by Health Canada and the government of Canada. Their mandate is actually to create a mental health strategy for Canada. And they have been running mental health first aid since 2007. And their mandate, along with creating a strategic mental health plan for Canada, is to lead the development and dissemination of innovative programs and tools to support mental health of Canadians. So some of this work includes offering resources, tools, training aimed at improving mental health and substance use literacy and improving mental well-being of all Canadians. So yeah, that's the background of the Mental Health Commission of Canada. I do not work for the Mental Health Commission of Canada, but I'm accountable to them. I do have to follow a specific protocol when I'm teaching. I teach the content as it's taught by every single facilitator in Canada. Of course, I bring my own experiences and background to the training as well. So yeah, that's sort of the background of the Mental Health Commission of Canada too. I think I've covered that. And yeah, I just would like maybe for you just to like reflect back if you're watching this or here live for a time in your life when maybe you were going through a hard time with your mental health or someone else you knew was going through with their mental health, and what maybe resources you felt like you could have used in that moment, if you felt empowered or not to navigate those challenges, and consider what it may have been like to feel a little more resourced in those experiences. So in regard to the actual training, so we'll get to the meat of that. This course is a 9-hour course, which sounds like a lot, but it goes by so fast. The first 2 hours are self-paced. So once you sign up, you receive an access code from me, which leads you to the Opening Minds portal for the Mental Health Commission of Canada. And on there is module 1. And module 1 is a 2-hour self-paced. It depends on how quick you do it. You don't have to do it all at once. You can do it over a number of days. But it includes that introduction to mental health first aid. There are some videos, some little activities that you do, sort of drag and pulls and matching definitions and learning some of the key words that we use in mental health first aid as well. And then, so you'll receive that access to that module 2 weeks before whatever training you take. So whether you're interested in taking this upcoming training that I have on my schedule, or perhaps organizing a training for your workplace or group, or taking a future training with me as well. 2 weeks before that training, you will get the access code. And then the 2-hour self-paced module needs to be completed 48 hours before the live face-to-face training. And that's to ensure that you have the skills and knowledge to move forward, because there's a lot to cover in this training. If you fail to do the 2 hours, you cannot come into the group for the live training. And because we need a minimum amount of people to take the training as well, so the Mental Health Commission of Canada mandates a minimum and a maximum amount of people that can be in the group. Depending on how many people are there, we may not be able to run training if somebody or multiple people don't finish module 1. So it's really important to get that done. It's super interesting. I still go back and look at the videos and refresh my mind too. So yeah, it's a fun little self-paced introduction. And then modules 2 and 3 are what we do together face-to-face. And so this training can be done in a full day, but it's a lot. I've done the training both in 2 half days and in a full day. And I really prefer the 2 half days, especially virtually. In person is a different story. We can go for lunch, we can hang out, we can stand up and move around, and it's a little more active in a different environment. But in virtual training, for sure, I really sort of prefer the 3.5 hours each. So each module is 3.5 hours long. Module 2, which is the first face-to-face component, is exploring declining of mental well-being. And so we do things like polls and breakout rooms. You spend time listening to me share. There are scenarios that we get to explore where we have sort of mock or fake people that are experiencing mental health issues or substance use problems. And then we sort of use the framework that we learn in module 1 and practice. And we practice as a group, and we explore what different strategies we could use and how we could apply the mental health first aid in that situation. Module 3, which is the second part, the second 3.5 hours, is mental health first aid for crisis situations. So in this particular training, piece of the training, we look at really more serious mental health issues, which we maybe come across every day, like walking down the street, or if we know someone with a really serious mental illness or a substance use problem, we may need those skills at some point. So altogether, the mental health first aid training helps us explore stigma, as I mentioned, reducing stigma, helps us explore what recovery looks like for individuals. We learn the signs and symptoms of substance use problems and mental health problems, including things like anxiety and panic attacks and diagnosed mental illness. Because many mental health problems, it doesn't even mean that somebody has a mental illness. As I mentioned before, it can be minor psychological, waves in life that we are all moving through. and then looking at the crisis situation. And then my favorite part of the training, which if you know me, you know how much I love and I'm passionate about self-care. So there's quite a big chunk of the training that is focused on our own self-care, not only how to care for ourselves if we're going through a mental health challenge, but self-care for the first aider. So we all hear words like boundaries, and we can only support people to the degree that we are resourced. And it's super important in mental health first aid to know that. So exploring self-care is a big chunk of that. And we get to have some fun with that as well. So that's kind of the training in a nutshell. The cost of the training is $250. I do have discounts depending on if I'm working with groups. I do have, a discount for this first session. If you don't already know that, send me an email and I'll share it with you. Just like I have a sliding scale for my one-on-ones, I never want finances to be a barrier for people to take this training. So if financial burden is a cause of you maybe not being able to take the training, please talk to me. There is a cost associated for me for every single person that I do train. So I do need to cover some of those costs and make a living. This is part of my job. But please feel free to connect with me if finances are an issue for you. The groups are small when we do this training, so they're groups of 8 to 15 people. In-person training, we can actually do 25. So that's a little bit of a change there. And it's really just to keep us connected as participants and feeling like we can ask questions that we need to, so that there's not a limited amount of time that each individual gets. And for me as a facilitator too, that I have the opportunity to make sure that everyone in the training is doing okay. Many of us have had experiences with mental health problems, substance use problems, either with ourselves or loved ones, friends, coworkers. And so sometimes this training can feel a little bit heavy. And I need to be sure that I can be here as a resource for you during the training if anything should come up. So I do also teach with a moderator. So there will be a second person with me when I do the training, just as another layer to create a safe space. And they also help with tech, like a lot. So all the polls and breakout rooms and stuff like that, they are helpful for that as well. So just know that if you do take the training, there will be another person here. You can see my puppy behind me giving a big stretch. She's been so good for me for this. She'll often be just in the background for the training, but not disrupting, hopefully. Yeah, I think that's all I sort of have for the meat of mental health first aid, why I think everyone should take it, why I love it so much. Like, it has really improved my own mental health since taking the training. And I have to say, like, I really have been exploring self-care and supporting people for many, many years. It's been part of my love and passion, but I have never felt more resourced since I took this training. And so I will say again how valuable I think it is. And I do hope that everyone takes it. So that said, I will leave it open. If anyone has any questions, you're welcome to write them in the chat. If you have no questions, it's also fine. If you prefer to send me an email, that's also okay. If you would like to ask a question, you're welcome to raise your hand or just unmute yourself. And yeah, I think that's it. The next session I have planned is 2023 when I'm recording this. Some of you might be watching this down the road. I am running the first session here June 15th and 16th. And then there will be more sessions as well, but that's the next session that is going to be offered. It is 2 morning sessions, so it's a Thursday and a Friday, and then the self-paced session before. I do want to mention, since I've been talking about mental health first aid a little bit more, I have had some workplaces come and ask if I do private group, virtual and in person, and absolutely. So if you are a workplace with 8 to 15 people, or you have that many people that can attend the training, I do have corporate and not-for-profit rates that are discounted as well. So happy to share this as far and wide as I can. And if nobody has any questions, oh, I do have a question here from Stacy. Stacy, you can go ahead and unmute, and you can go ahead and ask your question.
Hello. Hi.
Hi,
Can you hear me?
I sure can.
Okay. I just want to say thank you so much, Rebecca, for yeah, just explaining about what this mental health first aid thing is. Actually, um, I graduated recently from the social service work program, and I feel like learning more about this in a deeper level is really critical and so important to
Yeah.
be able to support others.
Mhm.
And I definitely would love to be able to have this opportunity. So
Mhm.
going to the info session, just hearing more about what it is and things like that. I just want to say thank you so much. And I have a question.
Yes.
So um for your email, is it the one that you sent out? It's raw holistic?
Yeah, rawholistic@gmail.com. I'll write it in the chat
Okay.
just in case anyone needs it.
Okay, sounds good. Just wanted to clarify, just in case if I want to contact you
Yeah.
about any other questions or just like for future sessions. Just wanted to know.
Absolutely, please do. And I do have a email list. And so if you aren't already added to that and you'd like to be,
Okay.
you can send me an email as well about that. And I'm happy to throw you on there too.
Okay, perfect. Thank you so much.
Yeah, thanks so much, Stacey. And thanks for doing the work you're doing too in social work, and all the best with your journey from graduating.
Thank you so much.
Thank you. So thank you to everyone else that came and was here, and feel free. I'll just hang on for another minute or so if anyone has any other questions. Otherwise, I'm just so grateful that you took half an hour out of your night to chat with me. And if you do come to the training, this is what it will be like. Me here, sitting with you there in the comfort of your space. We will have stretch breaks and all of that as well, and take time to ground into ourselves. It can be a lot, the training, but it's so, so worth it. So that said, I think I'll sign off. Thank you everyone for being here, and take good care. Hope to see you again.